Hello and welcome again, everyone, to our Wednesday news series, where we hear from social entrepreneurs and their teams from around the world about timely topics and solutions. My name is Bumi Otegbade. I'm based in Ashoka's Washington, D.C. office, and I will be speaking today with our guest, Dixon Chibanda, who's joining us from Harare in Zimbabwe. I'm very excited that we have many of you joining today from Ashoka's global community, and also a big welcome to everyone joining from Friendship Bench community, as well as Dixon's network. For the next 30 minutes, for the next 15 to 20 minutes, Dixon and I will be having a conversation, and then we'll open it up for question and answer in the last 10 minutes or so. Feel free to put your questions in the Q&A box at the bottom of your Zoom screen, and we'll get to as many questions as we can in the second half. And so, now we can jump right into the conversation. I'd like to, again, introduce Dixon Chibanda. He's joining us from Zimbabwe, where I am yet to go visit, but it is a high priority on my list. Dixon, I would like you, by way of introduction, to maybe just, tell us a little bit about yourself and Friendship Bench. And very next conversation, I'll get into kind of the spark and how you got there. But maybe you could just give us like a 1 minute introduction of yourself.
Thank you, Bunmi, and thank you for having me. So I am a psychiatrist by training, medical doctor who went to study psychiatry and public health, and the Friendship Bench, which is what I predominantly focus on, is really a psychological intervention delivered predominantly by trained community grandmothers. After the grandmothers are trained in what we call evidence-based talk therapy, they proceed to provide therapy within their communities. So what we do in essence at Friendship Bench is we train trainers who then go on to train the community grandmothers. The trained community grandmothers are allocated a wooden park bench. We facilitate referral to the wooden park bench through social media, through other existing non-governmental organizations, the local primary healthcare clinics. And after up to 6 sessions, but it can be much less than that, participants are invited to join a support group in their community, where they collectively problem solve around issues that they are facing within their communities. So in a nutshell, in a very simple, descriptive sort of way, that is what the Friendship Bench is, and that is what I have been working on now for just over 10 years here in Zimbabwe and beyond.
Okay, so Dixon, through this conversation, I am going to I'm from Nigeria, and I lived in Nigeria, most of my life growing up, moved to the US for education, and then moved back to be a social entrepreneur in Nigeria for 10 years. And there was a significant difference in terms of society and culture, and how, of course, people tend to work together and live together. Now, I'm going to go through this entire conversation as though I live in a quiet apartment by myself, and I'm dealing with some, interesting culture shock and mental health issues, as part of a kind of broader, like trying to exist in society, either here in the US or back home in Nigeria, right? And I'm really going to personalize this conversation. So the next question I have for you is, what happened to you? What was the story? What was happening around you that brought you to this moment, right? I believe maybe in 2007, when you said, there's a need for something, and whatever that thing is, is what led us to Friendship Bench. So what was that moment of a spark or realization for you, and how did you get here?
Great question. So I believe that the ultimate spark, although I think there are a series of events that have happened in my life, in my career trajectory that have led me to where I am. I don't think there's one single thing, but I believe that the key sort of trigger was the loss of a patient of mine by the name of Erica when I was still doing predominantly clinical work at Harare Hospital as a psychiatrist, during my formative years as a clinical psychiatrist. I lost a patient of mine by the name of Erica through suicide. Erica took her own life, and she had been a client of mine for just over 3 years. And when she took her life, I actually got the news from her mother. And over the phone, Erica's mother said to me, Erica had taken her own life. She had hanged herself in the family garden. Now, Erica and her family lived some 200 kilometers away from where I worked. So they used to commute, every second week for hospital visits, to talk to me and for me to assess Erica. And when Erica took her own life, they hadn't been to see me for a while. And when I asked the mother why, they hadn't come, her response was they didn't have the bus fare. They didn't have $15 to get onto the bus to bring Erica to the hospital where I worked. And it was that statement that actually, I think, started this soul searching. I'd already been doubting my role as a psychiatrist within the clinical setting, but the death of Erica was, I think, the final straw that really made me realize that what I was doing was not really assisting the people that needed my services the most. And so that was the beginning of my journey of soul searching. And through that, I realized that I needed to take psychiatry or my services to the community and not expect the community to come to me. So that's where the Friendship Bench journey actually begins.
Dixon, can we give people a little bit of a context, right? Of course, you're saying, you're talking about your work as a psychiatrist, and I'm thinking in the Western context, right? And how you have to book an appointment and show up at the office, etc. Now, maybe you can paint a picture, right? I think one of the core things you had mentioned was there's 12 psychiatrists, right, at the time in a country, Zimbabwe, where population is about 16 million. It is just a stark difference. It's very shocking. Maybe you can paint a little bit of a context for us in terms of what it looks like in Zimbabwe and when, in that context, and why this was so critical, and that work that you were doing, and kind of where you were and the kinds of meetings you were with, for example, that you're just like, okay, this is not going to work.
Yeah, actually, at the time of Erica's death, there were only 2 psychiatrists working in the public space, myself and a senior colleague called Dr. Sekai Niwatiwa, who's now late. So when we talk about 12 psychiatrists, which is slightly more at the moment, I think we're looking at about 16. It's really within in the last couple of years, which still is not sufficient for a country like Zimbabwe. And so it was really about trying to find a way of narrowing what we call the care gap within global mental health. And this was really my greatest sort of ambition. How do I ensure that as many people as possible have access to evidence-based care in their community? And that's where the whole idea of training grandmothers, because grandmothers are a resource in African communities that is readily available. They are the custodians of local wisdom and knowledge, and they are rooted in their communities. And so the whole idea of empowering these grandmothers and getting these grandmothers to sit on a park bench in as many communities as possible, enabling people like Erica, to actually find someone to talk to and not have to go to a hospital was really my main objective when I started the whole idea of Friendship Bench.
Did how many clients were you seeing per day or per week, right? Right around when Erica's death occurred?
So I used to work at a clinic, and when we ran our outpatients department, I would see on a single day anything between 40 to 60 patients, which is actually impossible to manage properly if you're going to do it carefully, So it was quite a lot, and we were not enough. We are still not enough, at the moment. We still face the same challenges. A lot of people who need our services just can't get these services because they are far away, or they have to wait long periods of time. But I also would like to emphasize, when we're at this point, that this care gap is not just a Zimbabwean problem, it's a global problem. I was recently in the UK where I do some work, and the waiting list on the NHS to see a psychologist or a psychiatrist can be anything from 3 to 6 months, in some cases much more than that. So the need for us to really think outside the box in terms of making evidence-based care accessible for those that need it the most is critical, not just in Zimbabwe, but globally. And when you think of Africa, just recently, the World Health Organization announced that Africa has the highest suicide rate in the world. In fact, six of the 10 countries in the world with the highest suicide rate are from Africa. And so there's a real need for us to be thinking outside the box, to be exploring the resources that are inherent in our communities to meet this massive care gap.
I think it's very powerful when we have models that come out of Africa for the world, right? This is a real model of something that's very interesting that can work. But I still want to dig a little bit into that moment where the idea of the grandmother came to you. Clearly you knew that you couldn't provide the scale of the services that were required. At what point did you come up with the idea of the grandmother?
Well, the idea of the grandmothers was really as a result of the situation that Zimbabwe was facing at the time, which is still the same now. Zimbabwe is a country that has faced numerous social, political, economical challenges, upheavals, and we've had a massive, massive brain drain. We have probably right now a lot more professionals from Zimbabwe outside Zimbabwe. That includes psychiatrists, doctors, nurses, it's everyone across the board. And so when I decided something needed to be done, my initial instinctive response to the question of who would do this were the nurses, the trained nurses at primary healthcare level. But I was immediately informed that you couldn't work with the nurses because they are overwhelmed. They are taking care of people living with HIV, maternal and child health issue, immunization, you name it. They just have too much that they're doing. Young people are extremely mobile, and a lot of our young people are leaving the country for greener pastures. So who else is left in the community who is stable and reliable? And it was through asking myself these questions that I realized that the only real stable sort of support at community level that is reliable and dependable are your community grandmothers. Of course, initially I thought of elderly people in general, grandmothers, grandfathers, and so forth. But with time, I realized pretty quickly that the grandmothers were a much stronger force to actually rely on for this kind of work.
Oh, that's just amazing. Can you help me understand the psychology of the grandmother as well? My, I have, of course, I had two grandmothers. One very much just deep, heartfelt. She was like an angel to me, right? You just go home over the summer holidays, like 3 or 4 months. We'd stay there. It was the only thing I ever looked forward to. And it
Yeah.
was just a safe space at all times. Of course, I've come across other grandmothers who might just address your problem and be like, well, just forget about that, do the right thing or think about it differently. Can you talk to me about the state of the psychology of first maybe 5, 6 grandmothers that you talked to, right? And how they
Yeah.
and responded to this idea?
Yeah. I always talk about the first 14 grandmothers that I interacted with when Friendship Bench started. In my TED talk, I talk about grandmother Jack, who was very influential in really changing the way I think. Unfortunately, when you look at the education systems that we have in Africa, they are all derived from Western models. And our thinking is that that which works in the North should trickle down to us and we should adopt it so it works for us. We never really think about homegrown solutions, indigenous solutions, which are based on the narrative, the stories from our older folks who've seen and done it all. So if there's one thing that I've really learned from the grandmothers, which I always share with people, is that every single one of us needs that older, sagacious friend who has seen and done it all. And I am so blessed that I have hundreds of grandmothers. And sometimes I think about, as Friendship Bench grows, I realize that I'm not really spending enough time with the grandmothers because I get my energy from these grandmothers, particularly the first 14 grandmothers. We've lost quite a couple of them, but the ones that are still around, they give me energy. They give me that sense of purpose and meaning in life because they help me to be grounded in the work that I do. And that whole concept, of intergenerational connectedness has become so critical in my life because I realize that I learn a lot more from the grandmothers, not only about how to deliver effective mental health care, but also about how to live a full life as a person. So to me, the grandmothers are almost like that North Star, something to look to, something to give me a sense of direction. And each time I sit down with them, I feel completely fulfilled. And it gives me that energy to say what I'm doing is the right thing. My relationship with the grandmothers has enabled me to be comfortable, to feel vulnerable as a person. In psychiatry, when you're trained, you're not expected to talk about your vulnerabilities. So one of the things I've learned from the grandmothers is that actually showing your vulnerability is a form of strength on its own, and it helps you to be a lot more focused in your life.
What has been the toughest challenge for you in working with the grandmothers in particular? I say that because I'm thinking, man, this must be positive for them. They have new purpose, right? New renewal and like new ways that they can support the community. But I imagine you may have had to give them new language as well, right? To kind of recognize you're a psychiatrist, you're trained. So they need to be trained as well. And I imagine you had to do a lot of that new learning. What would you say has been kind of the toughest challenge in working with them directly?
Ironically, it's me who's had to learn actually from the grandmothers. One of the things I've learned is the importance of using culturally appropriate terms when dealing with people's psychological, emotional distress, or when dealing with people's emotional, mental health issues. The grandmothers have taught me to be comfortable to use words like kuvura pfungwa, which literally means opening up the mind in my language. Kusimudzira, which means to uplift. Kusimbisa, which means to strengthen. And with the grandmothers, they won't talk about depression, but they will talk about kufungisa or kufungisisa, which literally means thinking too much. And when the grandmothers use these words, ordinary folks at community level can identify with that. And I strongly believe that that's one of the reasons why we managed to remove stigma from the work we do. Because this therapy on these wooden park benches is delivered, in public spaces. But because the language that we're using is not stigmatizing, and we are not seeking to put people into these categories, like medicalization of people's suffering, and labeling them according to the DSM-5 and ICD-10. But what we're really interested in are the stories, because through those stories comes the healing. And I believe that that's one of the power of Friendship Bench, which is not often talked about. It's the fact that Friendship Bench creates that space for people to share their stories. And through that storytelling or sharing, healing begins.
Okay. Let me get to some audience questions. One says, what does the grandmother's training look like, and how do people get referred to them?
Great. So the training has evolved over time, but very briefly, the current training consists of a 2-week in class, which consists of face-to-face for the first week and WhatsApp for the second week. And after that, 1 month of attachment at a facility where they are expected to at least see 4 clients under supervision. And after that, an exit sort of evaluation to determine which grandmothers are ready to go and start seeing clients on their own. The ones that are not ready go back into the cycle or are reassigned to become mobilizers who then go into the community to just talk about mental health but not provide therapy. So in all, it's roughly over a month, the training that we provide.
That's brilliant. Another question says, well, I think it's related to scale. Someone saying that they've read that FIFA will set up a friendship benches at the Qatar World Cup. Is that true? Is the idea there to have grandmothers trained as well? Is that related?
So
maybe.
So I had lost you, Bumi. Can you repeat? Yeah, the last word I heard was scale, and then you sort of froze.
No, that's okay. The question, I think, is related to where do we go from here, right? This is a brilliant model that's been developed in Zimbabwe. And I think, to your point, you showed how it's extremely relevant with the rest of the world, because appointment times, are make it very difficult for people to get the care that they need immediately. So the question is, how does the care get to them? So from a context of scale, someone's asking that they've read that FIFA will set up friendship benches at the Qatar World Cup. Is that related to the work that you're doing? If not, what does this look like for the rest of the world, and how might we take this idea to different communities around the world?
Right. Firstly, to answer the Qatar issue, yes, it is related. The whole idea of friendship benches in Qatar for the World Cup to represent the 32 countries comes from our work. The friendship bench being referred to there is friendship bench from Zimbabwe. Now, in terms of scale, one of the critical questions when you talk about scale is who is doing the scaling, or who is the doer at scale. We believe that Friendship Bench has gathered enough evidence, scientific evidence. We have well over 80 peer-reviewed scientific publications about the work that we do. So everything we do is rooted in in science, it's in research. That is part of our values. Our values are empathy, connectedness, rooted in research. And so we have the capacity to empower others to do the scaling. And so the model that we're currently using to scale is the hub and spoke, where Friendship Bench Zimbabwe is the central sort of technical and synthesis of knowledge that we then share with the rest of the world. At the moment, we are finalizing what we call the Friendship Bench in a box, which is really a DIY sort of kit to enable people across the world to scale this model, obviously with us providing support to those who need that support. So that is our idea of scaling at the moment. It may change over time.
That is just brilliant. A couple of questions are asking, people are asking about impact. How do you measure that the grandmothers are successful, so in an objective way? And then even from a kind of feeling perspective, how do you feel that the grandmothers are successful?
Right. So I'll go back to the basics in terms of how we measure success. So our very big sort of seminal publication, which was a cluster randomized controlled trial published in the Journal of the American Medical Association, showed that 6 months after receiving therapy from a trained community grandmother, people were more likely to be symptom-free and not have symptoms of depression in comparison to people who had received care from a trained mental health expert. In fact, the grandmothers were a lot better and more effective than Prozac as well in the management of depression and anxiety disorders. Now, how do we measure success? We have a baseline score that we capture for every client that comes to the bench. And this is based on some of the sort of more recognized international screening tools like the PHQ-9, but we also use a local one called the SSQ-14. And after 6 weeks, we measure the baseline. We measure the tool again in each individual. And success is a drop from caseness to non-caseness based on the screening tool. Recently, we looked at data for people who had been seen on the Friendship Bench last year in the month of August. In the month of August in Harare alone, we reached just over 5,000 people. And we followed up all of those people this year in August to find out where they were. And we found that the treatment they got from the grandmothers last year was really enabling them to keep going. There was a statistically significant difference in terms of where they were then and where they are today. So that's how we measure success, based on locally validated screening tools. And the other way we measure success is really the traction of our scaling. This year alone, we've managed to reach just over 60,000 people on the bench. And I'm talking about numbers in Zimbabwe. We don't really have accurate numbers of people seen outside of Zimbabwe. So those are some of our measures, but I'm very happy to share, a more detailed, impact report. And we also have quite a lot of information on the website. We can share our most recent third quarter impact report with whoever is interested.
Excellent. And there's a lot of interest. People are asking how they connect to the hub, if they want to be a spoke. Lots of questions around are the grandmothers paid, and essentially just wanting to have a deeper understanding of the model. So here's the last question as we hit the 30-minute mark. What are you working on now that you would really like everyone to know, and how to engage?
Wow, I'm working on many different things simultaneously, but I would say what really is beginning to be important for us is how we use digital platforms to scale or to enhance our scale strategy. How can we use digital technology to ensure fidelity as we train more and more grandmothers? That's one of the big questions that I am grappling with. And of course, finalizing the friendship bench in a box, which is a game changer for us in terms of where we're going next as an organization.
Thank you, Dixon. I am incredibly excited about this, and just I'm signed up to help to get this out there as much as we can. So thank you for joining us today. I know you did this despite a blackout in Zimbabwe and hotspotting your phone and whatnot, but it's just a testament to the type of grit and tenacity that working in Africa tends to require. And so it makes me extremely proud that this is a model for the world, right? That's born out of Africa, but going to the world. So thank you everyone for joining us as well. Look out for a follow-up email with a link to today's recording and highlights to browse and share. We hope that you'll join next time. Welcome Change is a weekly series about the future that we want to live in and the role we can all play in it. You can sign up using the link in the chat. Thank you again, Dixon, and thank you everyone, and see you soon.
It's a pleasure. Take care. Thanks for me.